Hey guys, this is Dave Tilley, and I am here just to give you guys a peek into what you are going to get when you guys enroll in the course. So once you guys sign up, this is kind of the first landing page that you're taken to, which is the course curriculum. It's kind of like your home base for navigating everything. And you can kind of see here first at a bird's eye view that we have the first module here, our background epidemiology type stuff. Our second module is our assessment and evaluation. So starting with a lecture just on evaluation concepts and then moving into a global assessment, kind of looking at local shoulder assessments here. So passive range of motion, capsular testing, strength, cuff testing, labral testing, AC joint. And then kind of moving down here to passive range of motion of the elbow and of the wrist, and then kind of breaking that down even further into, strength testing, elbow assessments kind of broken up into medial, lateral, anterior, posterior, and then same thing with the wrist, kind of dorsal, ventral, ulnar, radial. So kind of a really good breakdown here of all the stuff you need to know from an assessment point of view. These up here are a little bit more lecture based, a couple hours on actual epidemiology and review. These ones are all lab based. So we have a little short lecture here, but then this is all lab practical, me in the clinic doing stuff, and I'll dive into it in a second. But module 3 here is the acute and subacute rehab. So we're going to have basic rehab concepts, kind of just to think about, what do our progression timelines look like? What do we look like for like protocols and surgical rehab timelines, things of that nature. We dive into some passive range of motion, soft tissue care. How do we progress to active assisted and active range of motion? How do we start some baseline strength and dynamic stability of the shoulder? And then kind of same thing goes down with the wrist itself, wrist passive range of motion, wrist soft tissue care, getting some joint mobilizations, then localized strengthening manually, and also for a home program in the elbow wrist. So everything kind of we need in that first phase 1 recovery. Moving into phase 2. And then kind of the fourth module here is going to be advanced rehab and strength conditioning. So moving into a phase 3 or a phase 4 when, things are progressing and they need to get back to some baseline strength, some advanced strength. We're going to talk about, how we build pushing and pulling patterns in the upper body, how we get back to weight bearing and plyometrics, which are very important for gymnastics. Kind of break those things down, moving from the shoulder, elbow, and wrist, but then also kind of diving more into compound movements, but then also talk about how do we progress our local shoulder rehab, our local elbow rehab. So that's module 4 there. And then kind of here, the last one, which is a really important one, is how do we build custom return to sport programs for our athletes? So what do we do with, return to skill interval programs? How do we build it based on the surface, the number of days they're training per week, the level they are, their goals? So really long kind of in-depth lectures here on how we're kind of breaking that down. And then we also give you a lot of case studies, a lot of examples, but I'll jump back up here to the top and we'll just kind of dive into a couple of these lectures. So let's just look at the physical therapy lecture here. So after we kind of look through all the background stuff, this is a live lecture here about looking a little bit into how we can just break down, different exercise techniques, different progressions, what's the rationale for some of our stuff that we want to do? How do we blend some concepts that are really important? That's also going to be important with the research, and giving you guys a lot of resources to kind of dive into for, specific surgical progressions and timelines, but then also giving you guys kind of, the general bird's overview about how we're going to get somebody back on a conservative point of view as well. So obviously we want to have ideas for specific shoulder rehab after a surgery or elbow rehab after like an OCD lesion, but then also we want non-op and more conservative stuff. So just walking through all the different things that we do here, and then we'll jump down locally here to maybe one of the lab assessments. This is kind of an assessment just breaking down some shoulder and some capsular soft tissue stuff. So, what does the research tell us about what different ranges of motions will kind of indicate what soft tissue is limited or what capsular tissue portions are limited. So kind of going step by step and breaking down our glides, looking at some of our external rotation measurements, our internal rotation measurements. And then if we jump down a little bit more, we can check out some of the elbow and wrist stuff. So kind of peeking at how do we look at different pathologies, right? How do we determine whether somebody has an OCD lesion or whether somebody has a lateral epicondylitis, or whether somebody has on the medial side more of a UCL strain or more of a flexor pronator strain. So a lot of the common weight-bearing injuries that we see in gymnastics in the elbow and the wrist. So that's kind of all inside of the second module. We go through special testing, like I said there. And then kind of looking down here into the treatment side, right? We kind of talk about in the beginning, what do we do with somebody who's, really post-op? We'll look at one of these lectures first. What do we do with somebody to try to, get them through those first couple phases that are pretty tough for people? So those first 4 weeks when their shoulder, their elbow is really hot, what are we going to do kind of from there? And then we'll jump into some, actual progression here. What do we do for passive range of motion, active range of motion? How do we progress somebody back to some, ranges of motion that are probably a little bit intense for them to start with, but how we do this kind of safely. And then it kind of goes down here and talking about some beginning of manual strengthening. So some different techniques that I've been lucky to learn from Mike and Lenny. So just looking at how we can strengthen the cuff kind of in a baseline degree of range of motion once they're cleared to kind of set the stage there for some more advanced stuff down the road. And also have a section here looking at this from an elbow and shoulder point of view. How do we strengthen the forearm and strengthen the wrist to kind of get back before we do some compound movements like hanging or doing stuff that's related to weight bearing or things of that nature. So what are we going to kind of do from a global point of view to get the joints ready before we start going back into a compound movement point of view. So that's module 3. And then kind of module 4 is when we're diving into, like I said, the advanced rehab. So what are we going to do to kind of really make sure we're building up a high level of strength and a high level of dynamic stability before we get somebody back to that, advanced level of weight bearing or advanced level of hanging that they're going to have to do. So a little bit of a timeline progression there on how we progress some of these basics. And then we have a lot of these different exercise progressions here in the practical side of things, talking about how do we get somebody back to, basic overhead pressing, starting first with maybe a landmine press and then progressing down to some weight bearing and a handstand push-up, and then kind of getting somebody back fully to the point where they really need to do all of their exercises that would be necessary for a gymnastics training program. So how do we bridge that gap between the rehab aspect and the actual training aspect? And we have this here for pushing, pulling, horizontal pushing. We have some stuff getting back to, trickier areas like rope climbs and hanging and some progressions that are really good there. So lots of good stuff down in there as well. And then we kind of dive into talking about some plyometrics here. So what are our favorite exercises to get somebody back to a, more advanced level of force tolerance before we get them back into the actual gym? So what can we do from a clinic point of view to get them going before we ask them to go back and do some stuff related to, high intensity weight bearing or high intensity impact on their arms? So that's module 4. And then lastly, like I said, I'll dive into this program here about how do we build custom return to sport programs? So kind of looking at, what's going to happen here from a exposure point of view of how we're going to get somebody back. There's really good case studies that I'm going to share with you guys in a second, but a couple of case studies on shoulder and elbow stuff. And then how are we going to build, custom day programs that give them what they need to get back to some of their specific stuff. And I use some pretty high level examples so that you guys can, feel like you have a good understanding of how to program for a challenging high level athlete, but then also somebody who's maybe a little younger, a little bit more in the compulsory levels. So each section has a little bit of a start here where you kind of get oriented to the lecture itself, but it has full lecture downloads for everything. So if you guys want to, pull it up on your iPad and do it alongside of your actual progression for your computer, that's fine. You can print these out. You can have these on an iPad. You can download them, whatever you guys want. The audio and video will be here, but then you have your own kind of slides. So every lecture has the slide download. Everything has a lot of case examples, a lot of exercises. All of it's here for you guys to keep whenever you want. Then we have some really good case studies that I put together that I think are really helpful for people because they, help to kind of wrap up what do we do to practically put this into our everyday lives. And so I have a case study here about a pre-college athlete with a big shoulder surgery, and then we also have a case study here with more of the OCD, elbow type lesions, stuff like that, the weight bearing stuff, the gymnast wrist, the elbow issues. And so that is here for you guys to download. And then also we have some custom, programs that I've built and that I use in the lectures that I think would be really helpful for you guys to use. So, those are going to give you guys, not only my example of kind of how I walk through things, but it's also going to give you guys some blank templates. There's, this that's available that has an example, but then there's also blank templates that you guys can download and use and things of that nature. So, there's a men's and women's there. There's a men's and women's template that you guys can use. The case studies are downloadable. Everything that you guys have access to is pretty much yours for life. So as soon as you sign up, you get all this stuff. You can go back and review. But I hope that's just a little bit of an overview about what's going on. There's a lot more to it than this, but just kind of a bird's eye view. And so hope to see you guys inside the course.